Hello, everyone, and welcome. Thanks so much for joining us today at the Commit to Connect and Engage National Summit to increase social connections. I'm Sandy Markwood, CEO of US Aging, and we are so thrilled to have you with us today. With the support of the Administration for Community Living, US Aging has the privilege of serving as the coordination center for Commit to Connect since 2022 and administering Engaged, the National Resource Center for Engaging Older Adults, since 2017. These important efforts help to address social isolation and loneliness and promote social connection through their targeted and unique aims and activities. As social isolation and loneliness continue to impact the populations we serve, Commit to Connect and Engaged are focused in on being able to partner with you. And this social engagement summit is one indication of how we're all coming together to address these important issues. We are so thrilled to hold this year's summit in May, which is recognized as Older Americans Month. This year's Older Americans Month theme, Powered by Connection, recognizes the profound impact that social connections and meaningful engagement has on our lives. In saying that, we recognize that these social connections and meaningful relationships have direct impact on our health and our well-being. And this theme aligns perfectly with the focus of today's summit. Over the next 2 afternoons, we're going to be bringing together national, state, and local leaders for discussions on technology and social connection. Throughout the summit, we will be showcasing technology programs, tools, resources, and solutions that can enhance your organization's social connection work. Today, we're going to be focusing in on innovations in technology and the impact on social connection, resources to support your social connection work, as well as how the Digital Equity Act can help you reach consumers with broadband and social engagement, and also assistive technology. It's going to be a full afternoon of learning and inspiration, and I hope you will be joining us again tomorrow afternoon when we do a deep dive into machine learning and virtual programming. But before we get started with our great content, I want to briefly review some tips and pointers for your participation in the summit. First, let's highlight how you can connect to the summit and its speakers. You can submit questions for the speakers at any time during the summit by clicking the Zoom question and answer or Q&A button at the bottom of your screen. There will be time at the end of each of the sections to address attendees' questions. There's also a chat feature, and this is where you can introduce yourself and engage with the hundreds of colleagues joining us at the summit. If you need technical support at any time during the summit, you can also use the chat feature to get in touch with the US Aging team who can help. Second, we want to make sure that everyone can fully connect to the summit. Both American Sign Language and Communication Access Real-Time Translation, or CART services, are being provided on the summit platform. The video stream of an ASL interpreter will be spotlighted so all attendees can view the interpreters. To access a live transcription of the event, click on the closed caption live transcript button on the control bar at the bottom of the Zoom window, or you can access the live transcript in a separate window by clicking the link in the chat. And now, I am so thrilled to be joined this afternoon by Lori Gearhart with the Administration for Community Living. ACL is a leader in working to address social isolation and loneliness and is a key partner and funder of this work. Lori is the director of the Office of Interagency Innovation for the U.S. Administration for Community Living. In her role, Lori partners with other federal agencies, departments, national organizations like US Aging, and other state and local organizations to foster and develop partnerships that enable older adults, people with disabilities and caregivers to live at home and to participate and engage fully in their communities. Lori, thank you for helping us kick off the National Summit to increase social connections, and I'll turn it over to you.
Well, thank you, Sandy, and many thanks to you and your team for your work in developing and producing the 2024 National Summit to increase social connections. We are so grateful for our longstanding partnership, providing support and technical assistance to increase social connections through the Commit to Connect initiative, Engage, the National Resource Center for Engaging Older Adults, and today's National Summit to increase social connections. Wow, we have over 2,100 people registered for the summit. Each year, engagement with this summit grows exponentially. It's great to see more and more people championing this work and making connections. ACL is thrilled to be collaborating with US Aging, federal partners, foundations, national, state, and local organizations to work together to increase social connections for all populations. Over the next 2 days, you'll get to hear firsthand from our partners, learn from their best practices and strategies, and see an array of opportunities we have to increase social connections. The evidence linking social connection to positive health outcomes and well-being is strong and demonstrates that social connection is a fundamental need. Together, we can address barriers and facilitate meaningful and diverse social connections by strengthening our personal relationships, developing friendships, and creating opportunities to connect in our schools, workplaces, organizations, places of worship, and communities. Thank you, everyone attending, for all you do to increase social connections and for participating in the summit. Everyone's contribution and role is important and essential. We encourage you to make connections throughout the summit and take advantage of the opportunities to grow your relationships and network through the Commit to Connect initiative. Now, we are honored to introduce the Surgeon General of the United States, Vice Admiral Dr. Vivek Murthy. As the nation's top doctor, Dr. Murthy has championed social connection as a critical public health issue. Please turn up the volume on your computers to best hear Dr. Murthy's message.
Hi, I'm U.S. Surgeon General Dr. Vivek Murthy. I'm honored to have the chance to speak with all of you today during your annual National Summit to Increase Social Connection. And I want to particularly thank the Administration for Community Living, US Aging, and all of their partners for bringing us together. The Commit to Connect and Engage initiatives are shining examples of how we can address loneliness and isolation and build social connection for older adults and people with disabilities. 1 year ago, I released a Surgeon General's advisory about the public health crisis of loneliness and isolation. Loneliness is alarmingly widespread, with as many as 1 in 2 adults in America reporting measurable levels of loneliness. And certain populations, including older adults and people with disabilities, can be at higher risk. Loneliness and isolation can be significant contributors to mental health challenges like depression, anxiety, and self-harm. They also have surprising impacts on our physical health, including being associated with increased risk of heart disease and stroke, as well as dementia among older adults. The good news is that our connection with one another is a powerful force that can help protect against the damaging physical and mental health impacts of loneliness and isolation. That's why I'm so grateful to those who organized this national summit, and to each and every one of you who are working day in and day out to increase social connection in your communities. The kindness, compassion, and attention that you bring to this work has the power to brighten someone's day and improve their health. It's about small steps that we take, picking up the phone to a client instead of sending an impersonal email, asking about someone's family before discussing services or interventions, or simply taking an extra moment to make someone feel heard. We have to be intentional about creating community, and I feel hopeful because I know that's what each of you try to do every day. That's what brought you here. Throughout the summit, you'll hear from leaders working to leverage the best aspects of technology to help people connect and I want to take a moment to acknowledge that work too. When we take a thoughtful and careful approach to our use of technology, as I know the Administration for Community Living and U.S. Aging have, we can find ways to leverage it safely and effectively. This is especially important when we think about populations like older adults and those with disabilities who disproportionately rely on technology to communicate, to connect to services, and to access help when they need it. I want to close by thanking you again for all you are doing to help people foster and strengthen relationships in their lives. Your dedication and your heart give me hope that we can build a nation where no one has to struggle with the pain of loneliness, and where all of us can instead thrive in the warm embrace of community. Enjoy your time together, and thank you again for allowing me to join you.
Thank you, Surgeon General Murthy, for the inspiring message. Now I'd like to introduce my supervisor, friend, and colleague, Kelly Cronin. Kelly serves as Deputy Administrator for Innovation and Partnership at ACL. Kelly leads the administration of programs and initiatives that serve both older adults and people with disabilities, including consumer access and protection programs. This includes overseeing the state health insurance assistance program, grants to improve Medicare beneficiaries' access to low-income subsidies, and the state No Wrong Door System program for access to long-term services and supports. She also directs efforts to develop and integrate networks of state and community-based organizations to address social determinants of health and to advance the integration of medical and social care to improve health outcomes of older adults and people with disabilities. Kelly is a long-standing champion and advocate for our work to address social isolation and loneliness. Thank you, Kelly, for your continual support of this work, and please join me in welcoming Kelly Cronin.
Thank you so much, Lori, and thank you to Sandy Markwood for kicking us off, and to the Surgeon General for that really inspiring message. Thank you all for making time to be with us today. I also wanted to do a shout out for the U.S. Aging and ACL teams leading the Commit to Connect initiative, and who also have really put a lot of work into this year's summit, especially Katie Clark, who's our ACL lead, coordinating efforts not only across ACL related to social isolation, but also with our federal partners. So as you heard from the Surgeon General, Dr. Vivek Murthy, social isolation has a profound impact on individuals' health and well-being. And with his leadership and our coordinated actions, we are really well positioned now to make a lot of progress on improving social connectedness among older adults and people with disabilities. And while the Surgeon General has been raising the public awareness of social isolation and connection and promoting the pillars for a national strategy related to this public health crisis, HHS has also recognized that social isolation is an important social driver of health. And so in parallel to all the leadership he's been doing in the office behind him, the team behind him, we've been working across HHS agencies and really across the administration to implement this strategic action plan, which includes standardized measurement, routine screening, advancing partnerships between healthcare and community-based organizations, with the intent to help people who are isolated be meaningfully connected with others in their communities. So we've made significant progress since the release of the 2020 National Academies of Sciences, Engineering, and Medicine report on social isolation and loneliness in older adults. And also, through the height of COVID, and also through the Commit to Connect initiatives, we've seen a lot of innovative and efforts across the Aging and Disability Network. We've also been able to share and learn about those experiences, learn from those experiences through sharing in the nationwide network of champions, where almost 400 organizations are participating now. We also now have new opportunities through Medicare and Medicaid for payment of social drivers of health assessments, as well as coordination of community services and interventions that address health-related social needs, including social isolation. For example, there's new Medicare payment codes for community health integration that could support Medicare providers and their CBO partners with assessment and coordination of community services to address social isolation and other health-related social needs. In addition to new reimbursement opportunities, we have emerging evidence base, and we know more about what works in creating meaningful connections. There is so much innovation across states and communities during COVID, much of it involving the use of technology to support social connection. So we can now replicate and what has been demonstrated to have real impact and pursue sustainable approaches to scaling these successful interventions through all our available funding sources. Today, we're fortunate to have three thought leaders join us on a panel to talk about the future of technology and social engagement. First, we'll hear from Ronnie Snyder, Vice President of Programs at the John A. Hartford Foundation, who will highlight findings from a recent convening that Hartford organized with the New York Academy of Medicine on shaping a social isolation strategy. That'll be followed by a discussion with Ronnie, Steve Yule, from the Executive Director for the Consumer Technology Association Foundation, and Eddie Garcia, the founder and board chair of the Foundation for Social Connection. So with that, I will turn it to Ronnie.
Thank you so much, Kelly. I'm really excited to be here today, partly to share some information with you all, but actually just as much to learn from the entire group and this summit. So big thanks to you, Kelly, and to both the ACL and the US Aging teams who are putting all of this together. Next slide, please. I'm just going to say a few words about who we are as a foundation for sort of grounding for anyone who is not familiar. The John A. Hartford Foundation is a private philanthropy. We are indeed based in New York, but we actually operate all across the country. We operate nationally. And we were established by the family owners of what some folks may recall as the Great Atlantic and Pacific Tea Company, or A&P Grocery. And we have been in the area of aging and health for a long time. So longevity is a hallmark of our communities. It's also a hallmark of our interest in aging. And we focus on aging and also disability since 1982. And have made grants over the years totaling over $724 million. Next slide, please. This is our mission. We're dedicated to improving the care of older adults, and we do that through these three priority areas, as we call them: building age-friendly health systems, supporting family caregivers, and improving serious illness end of life. We really view these three very clearly overlapping areas as, and the work that we do as a catalyst for change. We think very long and hard about collaboration, and you'll hear a little bit more about that today. And collaboration means with many different partners, and all of our efforts have a lens to improve disparities. So I do want to note, because while social isolation, or as we like to reframe it, social engagement, it doesn't necessarily, you don't see it here on this slide. We think very much about the evidence-based 4 M's of age-friendly health systems as a measure in part of social isolation, of social engagement, and it relates to what matters. So as well as, of course, to family caregiving and serious illness end of life. Next slide, please. So I'm going to tell you a little bit about our initial interest in the area of social engagement. And then I'll talk a little bit about it as a sort of a way to frame the further panel discussion, which I'm really honored to be a part of. We held a convening, as Kelly mentioned, in January, on January 10th, at the New York Academy of Medicine, their Center for Healthy Aging, with our foundation. And it was really about exploration. It was to better understand what's happening and what we can do. The participants of that convening included, 6 different federal agencies, the CDC, the Office of the Surgeon General, we just heard from Vivek Murthy, ACL, of course, the National Institute on Aging, thinking about research in this area, and HHS, CMS, for example, and the Office of Disease Prevention and Health Promotion. It also included organizations like the National Academy of Medicine, Tivity Health, the Foundation for Social Connection, who we'll hear from, the National Skills Coalition, and get this, the Motion Picture Television Fund. In addition, of course, US Aging was there and Trust for America's Health, along with some of the measurement folks. NCQA joined. We also had several foundations in attendance. So the SCAN Foundation, the Weinberg Foundation, the CDC Foundation, various others that are called Primetime Partners, for example, and the Foundation for Art and Healing, as well as one of our longtime partners, RRF Foundation for Aging. So in addition to those organizations, we had approximately 20 other academic and research kinds of attendees from institutions across the country that have been doing amazing work and have really pioneered some of the various evidence-based programs and strategies that exist. Next slide, please. Okay, so the goal of this convening was really threefold. We've got two of them here on the slide. So first, to discuss collaborative action that can improve the care of older adults by addressing social isolation and loneliness. That was the sort of big stated goal. We wanted, as a part of that work, to review existing evidence to determine what actions a foundation can reasonably take to alleviate social isolation and loneliness in older adults. So I say a foundation because we were really thinking about our own programming, but we know that, I mentioned partnering, we know that partners are also interested in this. So last, and this is not on the slide, but really is determining where there are potential partners. Next slide, please. I have to note that we, as part of this, we really built on these two key reports. So the first came out in 2020 from the National Academies, called Social Isolation and Loneliness in Older Adults, Opportunities for the Healthcare System. That's very much where we see our work in conjunction with aging and the healthcare system. And it's very interesting that this topic has only garnered additional interest since 2020 and the pandemic, when so many people were locked down. And that's when this particular report came out that had been in the works for a bit. The second is the 2023 US Surgeon General's Advisory. This is around the epidemic, as it's called, of loneliness and isolation. So we based our work and our initial thinking on sort of pre-reading of these two reports, which I hope you will review if you haven't had a chance to yet. Next slide. So I have two slides on opportunities for implementation, and this is the first of those. This is what came out of that meeting with all of those partners that I listed, all the great minds and really passionate, interested folks. So funders, that's us and others, government agencies, and other organizations can address social isolation and loneliness among older adults and those with disabilities through the following possible 8 implementation opportunities. The first is inclusion as a social determinant of health. So the only additional comment I want to make on this is that I recently heard a CMS staffer mentioning that CMS is considering social determinants of health in conjunction with serious illness. With social isolation. Number 2, training of healthcare and social services professionals, also important. Number 3, promotion of partnerships between community-based organizations and healthcare, something that we think long and hard about in our partnership with both ACL and US Aging. And 4 is building upon existing federally funded efforts to develop a national resource center. Next slide, please. And these are the last 4 of those 8. So focusing policy efforts on older adults who've been historically underserved. So this speaks to diversity, but it speaks to other things as well, the sort of urban versus rural divide, among other things. Number 6, standardizing the approach to measurement and documentation. So you'll often hear that in order to really understand, we have to have the research. And we really need a standardized way of approaching. Number 7, ensuring that older adults are included as active partners in research and evaluation. That means older adults and also people with disabilities having a voice in what's most important to them and what would work best for them. And then last but not least, advancing the role of technology, which is something we will be talking a lot about today. So next slide, please. That's it for me. I just want to stop on, if you haven't had a chance, we hope you'll read those reports and the report that came out of the the New York Academy of Medicine. Please feel free to follow us and subscribe at the John A. Hartford Foundation if you're interested specifically in older adults. And I mentioned this earlier, but if you're familiar with us and our age-friendly health systems work from the Institute for Healthcare Improvement, know that we do consider the importance of social engagement together with ways to align with what matters to social connection. Back to you, Kelly.
Thank you so much, Ronnie. That was a great overview of what was an incredible meeting that I got to be fortunate to be part of. And really a nice, in some ways, a next generation of thinking after the National Academy's report and the Surgeon General's advisory. So thank you so much for sharing all that. So now I wanted to turn to the whole panel, to Ronnie, to Steve, and to Eddie, and ask you all to address the question, and then we'll be able to sort of have some specific questions for everyone. I'm also going to try to bring in some of the questions from the audience as we get further into the panel. So starting off, given all of this recent progress, and now we're 4 years after the NASM report, a year after the Surgeon General's advisory, now listening to all the recommendations from Ronnie, what do you think are some of the most important opportunities to pursue now to help people who are socially isolated?
I'm happy to start.
Okay, great.
There are so many, actually, but I'll focus on elevating the importance of addressing social isolation with healthcare teams, because I mentioned that's sort of where we live in terms of the work that we do. There's still a lot of lack of awareness about the really profound effects of and impacts of social isolation. And so we have a big opportunity with our age-friendly health systems, which has now spread to over 3,900 hospitals, ambulatory sites, practices of care, nursing homes, among others, where there really is a real consistent issue with isolation. It focuses on the delivery of evidence-based care in what's known as the 4Ms framework. And many folks have heard of this already. It's about aligning care that matters to people and their caregivers with the other things that are most important for care for older adults. Those are medications, mentation, which is anything cognitive, anything of the mind, and mobility, which is so much about function. Where we see a path forward with age-friendly health systems, we can have all of our care more attuned to mitigating those harms of both loneliness and isolation. And we really see a growing call for home care, which is part of people being known in their homes.
I'm happy to jump in, Kelly. That's okay. Yeah, I really appreciate the comments that Ronnie mentioned and all the great work, Ronnie, that your team has done at that convening, and building off of the tremendous momentum from the NASM report, the Surgeon General, but also the body of evidence and research that had been going on for decades before that around the value of social connection and its impact on our health and well-being. From everything that I've seen, and I've been in this space now for the last 5 years, everything that I've seen, I really think that the biggest push and biggest impact right now would be around federal policymakers taking action off of these frameworks, off of these great strategies, and helping to secure funding and authorities across programs so that we can all take action at the community level and to have a greater impact on individuals. So that for me is the biggest takeaway or biggest thing that I'm seeing as a big impact. The other, and I think Ronnie, you mentioned this a bit in your recommendations, but if we think about multi-solvers, so how do we think about social isolation, loneliness, and social connection as leverage points to solve for both connection and other social ills or social problems that we're looking to solve for, or in healthcare problems? So for instance, we've seen a lot of great impact of intergenerational programs that leverage older adults as tutors or mentors for children or students, or expecting new mothers, right? So using their life experience to help another person of younger age build, but also building connection and bond at the same time, building community within and solving for other social issues. So I think the more that we look for to leverage those multi-solver programs and solutions, I think the greater impact we'll have.
And I'll jump in to follow up on that because that's a great lead in, and I'll agree, Ronnie, great presentation and great report. I think that, going beyond the healthcare engagement that Ronnie was talking about, building on what Eddie was just saying, looking at those community organizations where there's opportunities for engagement, whether it is those intergenerational programs, other types of senior focused or disability focused organizations, but also just generally, clubs and other organizations in the community is a way to build those connections and build those relationships that can really help, whether you're in a urban, suburban, or rural community. And then last, I'll certainly touch on the piece that I know we're going to spend a lot more time on, and that is the 8th bullet that Ronnie had, technology. With the Consumer Technology Association Foundation, obviously that's something that we care quite a bit about, but it's understanding that the technology is a tool. Technology is a chance to help create some of these connections, but technology does not replace the people in the system. So it's looking at what is the infrastructure that can be put in place where technology can help support some of these connections, and what are those kind of 3 legs of the stool of having the hardware devices, having the broadband access, and having the support and education that can ultimately lead to creating the types of systems that will make connections for the people we're all trying to reach and serve.
That's great. And just to follow up on that, Steve, how do you think communities, states, and national organizations can partner with technology organizations to be able to promote social connections for the populations we're talking about?
Yeah, the great news is we are seeing the technology industry take a real interest in this issue and really starting to focus more and more on the needs of older adults and people with disabilities. In kind of a selfish way, I'll say, we created the CTA Foundation 12 years ago as a mechanism to help connect the industry with the organizations that are serving older adults and people with disabilities. So I would absolutely encourage people to reach out to us as a way to engage the industry. We do that through a variety of different activities throughout the year, one of which I'll also highlight. Ronnie's taken part at CES with us in the past. That's our big trade show. But we bring funders, but also other partners out to the show as a way to engage, see what some of the trends are in technology, but also see how do we help match that between the community organizations, between the funders, and between the technology industry that are building the products that are working in this space. So yes, there is a real interest as the industry. Quite frankly, they're recognizing there's a market here. So it's an opportunity for them to engage, but that's also where we can best engage them to help them understand why they need to engage the community in the design and production of these types of products. So yes, there's a lot more conversation that can be done.
Yeah, great points. And I guess also to build on that, and also addressing some of the questions that have been coming in through the chat, what are the ways in which we could be better promoting community partnerships, potentially with these technology partnerships, but the community partnerships, particularly between healthcare and community, where healthcare might be in a position where they're able to screen and notice that people are isolated, be able to they're in a position to be able to take action, but usually they see them on individuals on an episodic basis. It's just one physician's office, it's one hospital stay. They don't follow them, they're not in the community. And to one of the participants' point, 80% of health happens outside of healthcare. So how do we really make things happen in the community, but in partnership with healthcare? What do you think are some of the promising opportunities there?
I would love to respond to that because it's so important, and you're absolutely right. So we think about this in a number of ways. I will start by saying community-based organizations like area agencies on aging are super important in addressing isolation. And that's from Meals on Wheels programs to home visits. I mentioned various kinds of different home visits, caregiver support or nutrition services. The community-based organizations themselves can be a lifeline. And then in follow-up, the efforts of those community organizations can and should be strengthened and scaled up by using various resources from US Aging's Aging and Disability Institute. Now, that's something we support. It's also an institute that the Administration for Community Living supports. So we support it because it's designed to really build the capacity of community-based organizations to partner with healthcare organizations. And I don't think it needs to be said how critically important that is, because they reinforce each other. And then there are lots of digital platforms out there right now that were built to support people at home. Steve just made reference to some of those. They're building in online and sometimes in-person connections, often in connection with community-based organizations. So some of those are marketed through health plans, but others are marketed directly to consumers and caregivers. And I'll give you a little bit of a shout out, sort of a little by the way. We're in a planning process, myself and Steve and others through the National Academies, for a possible workshop, a possible forum rather, on social isolation and tech. And in addition to that, we just learned earlier today that the World Health Organization, so this is international, which is beyond what we do, but really important, has its own commission on social isolation. So there's both interest and action that's building. And I often say that coordination is amplification, because what we really want to do is rely on each other. Don't reinvent the wheel, but build together for a stronger network and supports for people broadly.
Yeah, maybe I could build off of what Rainey just said. So I worked really closely with the World Health Organization for the last 3 years on the launch of that commission, which launched in November. We were very successful in getting that to take place, and in having our own US Surgeon General as one of the co-chairs, along with others from across the globe. So we were really happy to see that. The reason I mentioned that, and I agree with Ronnie, it really does take action at all levels. At least that's what we believe at the Foundation for Social Connection, at all levels, from global policy to national policy makers being engaged and policy being developed, for organizations taking root and taking steps towards this, community action, and of course, individuals themselves, and supporting action across each of those levels. At the Foundation for Social Connection, we have taken more recently a community lens to our work. We've done a lot of work at the sort of national and global level, now really looking at how we can foster community engagement on this topic. One of the things that we've developed is an action guide and toolkit for local community leaders in developing their own community-wide strategies to fostering social connection. That guide, which was developed under a grant with the Einhorn Collaborative and Harvard University, helps to develop this step-by-step process for communities to assess their needs, to assess their assets that are already in existence, to articulate and figure out who are the right stakeholders to lead a collaboration across sectors within their community, then deploying evidence-based practices, evaluating their impact, and communicating their impact on an ongoing basis. As part of that, I would say that healthcare, of course, is a community stakeholder. And so as part of that assessment, we identify FQHCs, county departments of health, healthcare professionals and providers themselves within communities, but also thinking about payers. And so, for instance, we've done a lot of work supporting payers and their strategies, especially in the Medicaid and dual eligible population, those who are dually eligible for both Medicare and Medicaid. And how do we help to foster community-wide strategies for addressing social connection? A lot of the payers are looking at both asset development within communities. So for instance, United Healthcare has a program called Community Catalyst, which is supporting the development of community-wide strategies to address social determinants of health broadly, one of those being social isolation and loneliness and social connection. They're doing that across their Medicaid markets and the 36 markets that they're present in. Payers are also looking at, as Kelly's kind of mentioned, looking at opportunities for screening and deploying community health worker models and others to go to homes and do those screenings and connections with their consumers and getting them engaged in care and in connection to community-based organizations that address social isolation and loneliness. I think that we also, I think, I forgot, maybe it was Rainey, but Meals on Wheels programs play a role here. The AAAs, of course, and everyone who's on these calls. Stakeholders broadly should be thought of as part of the community, not just community-based organizations and not just healthcare. I'd say.
Yeah, and to build off that again, certainly we're also a domestic funder, but we recognize that this issue doesn't stop at any border. So looking around the world and seeing the best examples of how other countries are addressing some of these issues gives us the guidance on how can we build programs here in the United States that can serve and then share the lessons that we learn here in the United States with other parts around the world. I think that is critical. And I think it also builds off the examples that both Eddie and Ronnie shared. We work with so many different local organizations, with different regional organizations, as well as national organizations, and everyone's doing their own kind of take on how to address some of these issues. And for instance, we've been working with the villages, and we did a program with DeRote on doing technology education and developing something that can be shared across the various village to village model, but also recognizing that if you've seen one village, you've seen one village. So how do you really build something that's flexible enough to change from one location to the next, but also is something that can provide that baseline? Because each organization is finding really incredible learnings as they're developing these programs. And that's where I know, Ronnie and I have been involved with Grantmakers in Aging to help bring funders together to help share what are the best examples of the works that we're doing. But really, we need to do more work across the entire network of sharing the best examples of what's working, what lessons we've learned, because we also have to share what didn't work. Sometimes those are the grants that, really we learn the most from, and be able to share that in a broader way. And I think that's a really important part of this conversation.
Yeah, and that's also related to something we wanted to talk about in terms of what really are the best strategies and resources for replicating and scaling what we know to be working. So, because we know of all these pockets of innovation that have been fueled over a number of years and in different countries in some instances. But now we want to be able to be more disciplined in replicating and scaling, knowing there's always going to be local partners that are going to have slightly different interests or approaches, but we still have this opportunity in front of us. And just to also speak to some of the questions that have been coming in through the chat, the new reimbursement opportunities on the Medicare and Medicaid side are fairly technical. It'll take a long time to explain. We'll try to follow up after the summit, but one that I'll just call out because it's available now through the physician fee schedule under Medicare, allows reimbursement to do assessments, reimbursement to do community health integration, meaning if somebody is screened positive for food insecurity and social isolation, they can be referred to an area agency on aging or a center for independent living where that person can do a deeper assessment and really think about all the community resources or interventions that are available that they could be connected to and follow through and coordinate all that, follow them over time and make sure that they realize improvements and circle back to the healthcare provider to know that they're doing better and to tell them what happened. So it's really part of a whole sort of extended continuum of care, if you will, but making sure that social connection is a part of that. So that's one newer opportunity under Medicare, and under Medicaid, there's a lot of state flexibilities now for example, under Medicaid managed care for in lieu of services that are being delivered or reimbursed in lieu of another medical benefit, but that could affect a health-related social need like social connection. So they're playing out differently state by state. So in Georgia, you'd have to look to see what's happening in Georgia and other state-specific scenarios. But again, exciting emerging opportunities. And really, again, between partnerships between plans and CBOs or healthcare providers and CBOs. But with that new knowledge, Like, what do you all think about in terms of what are the most promising replication and scaling strategies?
I was going to let somebody else start first this time.
I was deferring to you, right?
Go ahead.
Okay. So I appreciate the call out, Kelly, and I think you're absolutely right. I think there's been tremendous movement already within the Medicaid programs across the country, and engaging the MCOs, the Medicaid Managed Care Organizations, and that has now taken a root in the Medicare program. I think that what we're seeing is that there's a true need, and I forget who mentioned this too, but a true need for true standardized assessment and standardized measurement of impact. So, and we do know that there are already developed measurement and scales and tools for that assessment. So I think the deployment of that standardized measurement and scale to be used, I think is important as a first step, and something that can be done. I think that's a big one. I think there have been a lot of opportunities to engage between community-based organizations and the healthcare sector. And so I'm just calling out what you already said, was that these sectors have already been engaged on social determinants of health. That concept, which is now decades old, in addressing, I'm a master's in public health, so that's why I mentioned that. That concept that's decades old and the impact that it has. And we now see this opportunity to incorporate social isolation, loneliness, and social connection into that body of work. So I think continuing, again, to look at multi-solvers, using social isolation and loneliness as part of a social determinant of health strategy, I think is going to be the easiest path forward.
So I'm going to jump on that. Great response with a couple of additional things. First, I have to note that for those who are interested in using the report from our recent convening, it was this calendar year in January, that report includes a discussion of scalable tools and resources, for example, different approaches to accelerating successful interventions and opportunities for implementation. And then I'm actually going to give a shout out for two of the other entities on this panel. So when I was thinking about this and looking around for additional thoughts and resources, the Foundation for Social Connection actually has a lovely intervention catalog of existing programs and products and services. There's a range. I took a little deeper dive. There's a range of virtual and in-person and some phone interventions. I was really interested. So shout out to you and your team, Eddie. And then, of course, at ACL, the Commit to Connect group and initiative has got a lot of resources. And I think those are great places to go and understand what's out there and determine then what's the best fit for your organization or your community or the needs that you are seeing as you're thinking about this. And I'm super excited to hear what Steve says because he's got all the cool tech stuff.
Well, and I'm not the healthcare expert on here, so I tend to look more at what are some of the off-the-shelf solutions that are available? What are some of the types of solutions that different organizations can adopt? And we've mentioned them in many cases already on this panel. Some of the ways that Meals on Wheels are really adopting different types of technologies and going beyond just delivering the meal. It's more than a meal, as you often hear them say, to provide those types of connections and look at different types of solutions that can essentially, help to create those types of connections and monitor where there's issues and share that across their network. Looking at the way the AAAs are adopting different types of solutions. And we've seen everything from, virtual connections, virtual senior centers, virtual academies, other programs along those lines to, ways to do that hybrid environment of how do you bring people together? How do you provide the transportation solutions? That's a technology that often gets overlooked of getting people out of their homes and opportunities to get together. So we've worked with organizations like ITN America to develop a nonprofit ride-sharing service around the country that can really help people get access to, rides where in the past, once you lost the ability to drive, that really, meant you were either dependent on friends or family, or, paratransit and other things along those lines, which can be challenging to schedule. So looking at some of the solutions that can be, brought out in a large scale, we're excited to see. We also think it's important to engage the technology industry in this. We're seeing the installer community, the people who, in the past, you think of them as the people who might put a high-end home theater system in your home. A lot of these are small businesses. These are mom and pop shops in communities all over this country, and they're recognizing the importance of, aging in place technology, and the types of technologies that they can help set up that will help you connect to friends and family and to other programs around the country and around the world. So it's an opportunity to really engage those local small businesses and build out the types of solutions that can help people stay as independent as long as possible.
Could I just maybe take it in a slightly different direction for a moment? I just want to make sure. Would be remiss if I didn't mention it. I do think that these dialogues often go very much to the individual focus. Like, so what are we going to do for this one person? And that is justified. However, that also carries stigma with it, that there's like a burden that this person has to have a solution. And I think the Foundation for Social Connection has been very focused on how do we think about policy systems and environmental structures that have an impact on our communities, and how that also leads to social disconnection. So with a focus on social isolation and loneliness only, and not a focus on social connection, we tend to think about just these one point in time solutions. And I believe that there's a place for both. I want to make sure that we, at least I'm saying that, we have a dialogue around that. I think the other part I wanted to make sure I mentioned, if we are thinking about individual solutions, the reason that assessment is so important is because there are finite resources, and not every solution is going to work for everyone's problem, right? And so we think about social connection across three levers. One, is there social isolation or not? Does the person have connections with others or not? That's the structure of their relationships. The next is the function of their relationship. Do they have the types of relationships in the variety and types that we need to survive as humans and to feel as a member of society? Do they have all those types of solutions, of those types of relationships? So think about mentors, best friends, parents, loved ones, people that you see just walking down the street, that you can wave to, and your neighbors. Do they have all these types of relationships? And then finally, looking at the quality of those relationships. So you can have a partner, but it can be an abusive marriage, right? And that's not the kind of relationship that we want for someone. So solutions also have to be solutioning for the exact need of the individual. So that's why I think that assessments are so important. Then we can drive the right solutions on the individual level. And again, I still think that we should be having dialogues around the policy systems and environment that are leading to social disconnection from a social fabric standpoint.
I love that, Eddie. And that's exactly why we think in terms of evidence-based programs, because we want to start there so that we know it works. And as you said, not the same thing does not necessarily work for everyone, but we want to understand that there is documentation that it's making a difference for the people who are who we're trying to assist overall.
Agree.
Great points. I'm also circling back to what some of the questions have been coming in from the audience, and there's a couple related to understanding who in a community is isolated. How do you identify that, or how can you incentivize people to routinely screen? I'll just mention briefly that the Centers for Medicare and Medicaid does have screening measures in place for social drivers of health. One of the domains, social connection or social isolation is not included in one of the domains, but it is starting to routinely happen among hospitals, among many different types of healthcare providers. And it's still possible to add a question around social isolation if a provider or plan would choose. It's just not required at this stage, but that is one emerging opportunity. But Eddie or others, do you have thoughts about how to better identify who is isolated?
Yeah, we do know historically that certain populations are already at higher risk of social isolation and loneliness. So I'll get there to answer your question. So we know that people living in rural communities, that new moms, veterans, we know that people living in lower socioeconomic status, BIPOC communities, LGBTQ communities. It's the same that we've seen with social determinants of health and looking at health equity. So we know those populations at greatest risk. From that standpoint, based on data that we have available, the providers, community-based organizations, providers from the healthcare sector, and payers should be targeting their screening capabilities within those communities. So for instance, we did a program with the Centers for Medicare and Medicaid Services looking at social isolation and loneliness in nursing home residents. To reach the highest, have the highest impact, we focused on nursing homes in lower SCS zip codes and ones that were in rural communities. So, because of that, we got a larger number of people who identified as socially isolated and lonely.
I love that there's a lot of really cool things coming in over the chat as you asked the questions, Kelly, and you answered, Eddie. So there are some really good things for folks to check. I'm really heartened because there is additional attention to this topic across the board. I mean, I did start earlier by saying that many clinicians aren't paying attention, but more and more are, and that's really encouraging. I mentioned to you that I recently heard someone from CMS mentioning social isolation as one of the ways that they're thinking about social determinants of health. We know that matters. And there is a project of ours that I can think of off the top of my head. We do some work bringing age-friendly health systems to CVS Minute clinics so that we're wiring the country so that any CVS Minute clinic that an older adult goes to will automatically give them best care for older adults. And as we saw some of the data that they've been measuring, they're tracking social isolation as part of that. Now, I can't tell you exactly what the ways they're asking that question, but when I saw that, I was really encouraged on this overall topic and recognizing that it is becoming more and more clear to the broader public how important this is.
Yeah, I don't have a whole lot to add. I really think it's a matter of finding those locations that are already engaging with the older population or the disability community, and providing that level of education so they know what to look for and where those challenges are. So I think my fellow panelists already hit all the main points here.
And Steve, just to close out, I know there's great interest in some emerging technologies or just technologies that are really becoming mainstream in our culture now. Do you have any thoughts on really what newer technologies or what are the most promising technologies now we should be thinking about in terms of social connectedness?
Yeah, I think there's a few different technologies. Certainly, if you're looking at what is available today, honestly, the phone that so many of us are carrying around with us, it is something that can provide scheduling of activities, engagement with the medical community, engagement with other clubs and activities, being able to text with friends and family and loved ones, and yes, it actually also does phone calls and video too. So that is probably the first and foremost what we see now. Obviously, that is not universally adopted. That is something that we need to be aware of. But looking at the level of adoption that we've seen of smartphones and non-smartphones as well as ways to do that basic connection, I think that is the first and foremost. We also see the voice assistants and the opportunities to engage. They're getting smarter and smarter, easier for people to engage with their homes with their devices, but that can also lead to being able to connect, being able to say, I want to talk with, my son or my daughter or others. It's amazing to see the social connections that can come from there. Another currently adopted technology or available technology is the over-the-counter hearing aids. Hearing loss is such a challenge for social connection. So having another level of support that can provide that, entry level into hearing assistance can really make, it makes such a difference in the social connection, getting, families to be able to better understand each other as they're having those conversations. So those are some of the existing technologies. As we're moving forward, we just funded a project with Lutheran Services in America around a social robotics pilot. Once again, the robots do not replace the people in the system, but we don't have enough caregivers in the system. So are there opportunities for AI and robotics to help take some of the load off of some of the caregivers, free them up to be able to be engaged more in social engagement? So I think that's one of the interesting areas that we're seeing emerging. I guess you have to mention AI just because, these days in technology, AI is everywhere, but it's getting smarter and smarter. It can help with many of these activities. And the last I'll raise is self-driving. Once again, going back to the challenge of transportation, being reliant on others. We did a focus group a couple years back where everyone kept telling us older adults would absolutely be terrified of self-driving vehicles. Turns out, if the group that we were talking, a couple groups that we were talking to, if they don't have access to independently drive anymore, well, guess what? They were very excited for the opportunity to just be able to get up and go wherever they'd like to go on their own schedule. So obviously that is further out, but I think there's some exciting opportunities for social connection, because that leads not just to going to your medical appointments, but that's going to the restaurant, going to the movies, going to all the other, parts of life that often get left out of the conversation about aging and disability.
Such great thoughts. Thank you. And I'll just also put a plug in for evaluation of all of our technology implementation. So we really do get the human and technology interaction right, and we preserve privacy and autonomy. And I think there's so much happening that everybody's excited about, but we also really want to do it responsibly and carefully, channeling what the Surgeon General started off with. But thank you so much. This is such a great panel. You had so many great insights and pearls of wisdom. So great way to start the conference. Thank you for joining us. And I'm going to turn it over to the organizers now for the next session.
Thanks, Kelly.
Thank you.
Hello, everyone, and thank you so much for joining us today. My name is Katie Clark, and I lead the Administration for Communities Living's work on social connection under the leadership of Kelly Cronin and Lori Gerhard, who you heard from earlier today. I will share very briefly about ACL's work to promote social connection among older adults and people with disabilities as a part of our Commit to Connect initiative. Then Meredith Hanley from US Aging will also share resources that are also available through their National Resource Center for Engaging Older Adults, or Engaged. You can go ahead to the next slide. ACL's mission is to maximize independence, well-being, and health of older adults and people living with disabilities, and also family caregivers. And we know that social connection is central to this mission. Commit to Connect is ACL's initiative that solely addresses social isolation and loneliness by increasing the capacity of professionals and volunteers in the aging and disability networks to better promote social connection. We can go ahead to the next slide. So we are so thankful to US Aging to serve as our coordinating center for this initiative. And I encourage you all to check out our website, but again, very briefly, just highlighting our work today. We can go ahead to the next slide. So our strategy is twofold. we work to increase the awareness and also the availability of programs and strategies that we want to encourage adoption, encourage replication of. And now we also build and strengthen collaboration with current and also potential partners to leverage collective efforts, resources, innovations, and activities to increase social connections. Go ahead to the next slide. So we do this in a variety of ways. We provide technical assistance and training to, again, grow that capacity and awareness about the prevention, detection, and response to the negative health effects related to social isolation and loneliness. That includes today's event, the National Summit to Increase Social Connections. We also host a variety of webinars that highlight subject matter experts, program examples, with extended office hours for informal dialogue and learning. We also develop professional resources to include topical guides, toolkits, and research briefs. Our communities of practice are competitive, high-touch opportunities for agencies, organizations, or networks to collaborate with subject matter experts to advance innovation in the field. Our current community of practice is focused on measurement and evaluation. We are working with Meals on Wheels of Ohio and Kentucky, California Department of Aging, and also the Cincinnati Music and Wellness Coalition to apply a screening tool to analyze, collect, and use data to better understand their program's impact on social isolation and loneliness. We also partner with Engage to host an innovations hub, which Meredith will share more about shortly. We can go ahead to the next slide. So I want to highlight one really unique part of our work here at Commit to Connect, which is our nationwide network of champions. This is a free and online community for champions of social connection at the local and state and national level. This is a member-driven platform that encourages collaboration. It aids momentum through informal conversation on discussion boards, a directory, a resource library, events, and also private communities for coalitions or groups. For example, we have one for our community of practice and also the Wisconsin Coalition for Social Connection. Members often share funding opportunities, post events, share recent findings, and introduce themselves. Most recently, members also shared the experiences and solutions for navigating staffing shortages and how to best conduct outreach in hard-to-reach populations. We can go ahead to the next slide. So we are currently almost at 500 members, I think just around 490, representing over 450 organizations from 47 states across the US, from a variety of sectors and roles and perspectives. This nationwide network of champions is a grassroots community of professionals, of volunteers, of caregivers, all interested in social connection as a fundamental social determinant of health. Every day, we see professionals supporting each other, connecting and sharing their experiences and learnings with each other in this nationwide network of champions. We will be sharing the link to join this community in the chat. It's also available on our website, but I strongly urge everyone attending our summit today to join and become a member. We all have so much to learn from each other, and joining is free and open to all, and a great opportunity to continue this momentum in this work. So thank you so much, and I will now turn it over to Meredith.
Great. Thanks, Katie. I'm Meredith Hanley, a program director with US Aging. I oversee our social connection work, as well as our caregiving and kinship care related efforts. And so within the social connection realm, I oversee US Aging's role with Commit to Connect and the Engaged Resource Center. Today, I will just talk briefly about some of the great resources available through Engaged. And you can go to the next slide. So the aim of Engaged is to increase social engagement of older adults, people with disabilities, and caregivers by supporting the work of the Aging Network. Engaged has been in place since 2017 and is funded in part by ACL and operated by US Aging. Since the inception of Engaged, one of our key partners, although we're guided by a broader advisory committee, one of our key partners has been Older Adults Technology Services, also called OATS, or OATS from AARP, since they work with AARP now. And much of the work of Engaged focuses on identifying and disseminating information about emerging trends. And we also do a lot of work developing new resources, compiling best practices, to all with the aim of, again, helping the Aging Network and Aging Network partner organizations expand and enhance their programming efforts related to social engagement. Next slide. So I just wanted to highlight some of our resources. One of the things that Katie mentioned is the Social Engagement Innovations Hub. That's a database we maintain of social engagement best practice examples, and it's housed in a searchable online clearinghouse, and that's now operated in partnership with Commit to Connect. I'll have a slide with a little bit more detail on that momentarily. Engaged also has a variety of consumer-facing materials, many of them co-brandable, so agencies can add their logos or contact information as they disseminate those materials and give folks a local resource to connect back with. We also have a variety of toolkits and template materials. We try to always provide grab-and-go language, so materials are as easy as possible to use in your agency as you do your work. We also have a variety of publications and different videos. We offer different webinars and have a great webinar archive on a host of different topics that intersect with social engagement. Next slide. So I'll just take a bit of a deeper dive on most of those topic areas that I just mentioned on the last slide. So the Innovations Hub is, again, that searchable online clearinghouse of social engagement innovations. One of its key features is that it's searchable by a variety of filters. So, for example, you can pick the intervention type that you're interested in. One of the intervention types that you can filter by is technology. Mentioning that, of course, since it coincides with the theme of this summit, but there are also other options within that filter. And of course, there's also the search function. So you can use a magnifier glass and search for keywords. Maybe you would want to search by hybrid or virtual or just the broader term of technology and see the different programs that use those keywords. As I mentioned a bit about, the Innovations Hub originated with Engaged and is now cross-posted on both the Engaged and Commit to Connect websites to reach broader audiences. We are working to continue to grow the hub. It has over 80 examples currently. The hub that's posted on the Engaged website will remain focused on examples pertaining to the Aging Network, while the Commit to Connect hub will feature those listings in addition to a broader array of examples as well. And I always like to put in a plug. If you have a program that you think should be listed on the hub, we accept submissions at any point. So there's a SurveyMonkey application, and then each submission goes through a review process. So you can submit your program for potential inclusion as well. Next slide. In terms of some other resources we have, Engaged published a consumer-facing technology booklet called Tapping into Technology to Stay Connected and Engaged. And this resource was developed with the Elder Care Locator and OATS. And this material can be shared with older adults to help them understand how tech can help them stay engaged with family, friends, and in their community. It also highlights different technology options, how to get connected to different types of technology. So it's full of a lot of tips and resources. And it's also available in English and Spanish and can be customizable for agencies to add their logo or contact information. Next slide. We also partnered with OATS on a variety of new fact sheets last year on topics all related to engaging safely and securely online. So there was a fact sheet on protecting your personal information online. There was a fact sheet on socializing safely online, and also one on browsing the internet confidently, all kind of chock full of specific action steps and helpful tips that are frankly helpful, I think, for everybody to have some of these reminders sometimes, since since it is easy to get. There's different things out there, scammers and phishers and whatnot, that we all need reminders on to not fall prey to those. We also have, next slide, some technology manuals. Now, these are geared for organizations as compared to consumers, which the other resources were for. And these tech manuals are all about helping agencies that are interested in or perhaps want to enhance either their virtual programming or their hybrid programming. Hybrid being when they are doing a virtual and in-person event at the same time. Again, all chock full of tips and best practices. Next slide. So this slide contains the engaged contact information. If you just navigate to our website, which I know is in the chat, you'll find the link for Facebook and X/Twitter. And one more slide. We'll just put in a final plug for some of our favorite resources that Katie and I mentioned. Become a champion, join that nationwide network of champions that Katie mentioned. It's such a great resource. Visit our websites. If you're not part of our newsletter yet, sign up for the newsletter, and certainly browse the Social Engagement Innovations Hub as well. So we're at time here. I think if you have any questions, type them in the Q&A box and we can respond. We'll just kind of type our responses. We do want to make sure folks get a little chance for a break, since this is a 3-hour session here. So stay tuned, don't disconnect, and we'll be back with you right here at 2:30 Eastern time.
Hello, everyone. It is now 2:30. We have a full agenda for the rest of today, so I will now begin our afternoon session. I am honored today to introduce Angela Bennett, who is the Digital Equity Director at the National Telecommunications and Information Administration. In this session, Angela will highlight the Digital Equity Act and how communities can work with state broadband offices to better serve older adults and also people with disabilities. The chat has already been so lively, and I encourage folks to continue to engage and ask questions in the Q&A box. We will have some time after her presentation for some questions. So Angela, thank you again so much for joining us today, and excited to hear this presentation.
All right, thanks a lot, Katie. Good afternoon, everyone. I am so honored to join you today. As Katie shared, my name is Angela Thee Bennett, and I am honored to serve as the Digital Equity Director under the U.S. Department of Commerce's National Telecommunications and Information Administration, NTIA. So today I'm going to share with you information about our Digital Equity Act programs. And as Katie said, I'll, be available to, take some questions as well. Next slide, please. And so in addition to going over the digital equity programs, I do want to talk about how the work that we are doing helps advance the social determinants of health and, create conditions for thriving communities. And I'll also go over specifically our capacity grant program, which we recently launched in March, and review some key dates and deadlines for you to be aware of. Next slide, please. Next slide. And so under the bipartisan infrastructure law, which was passed in November of 2021, Congress allocated $48 billion to NTIA to help connect individuals and households to affordable, reliable, high-speed internet. As a part of that funding, $42.45 billion was allocated for the Broadband Equity, Access, and Deployment Program, which we call BEAD. And this program has three priorities. The first priority is to make sure that every household is connected to affordable, reliable, high-speed internet. So if you think of it, it's the broadband infrastructure to physically connect the households to the internet. The second priority under BEAD is to make sure that at least a gigabit of service is available to community anchor institutions that the states have identified in their BEAD plan. And then after states have accomplished the first two priorities, any funding that's remaining can be used for what we call non-deployment uses. And that's any digital inclusion activity to help individuals meaningfully use the internet. Today's focus will be on the Digital Equity Program, which is the $2.75 billion that was allocated to advance digital equity for all. I also want to just touch that as part of the $48 billion, Congress also allocated $2 billion to the Tribal Broadband Connectivity Program to not only connect tribal communities to internet, but also ensure that they have the skills and the resources they need to meaningfully use the internet, and then $1 billion for the Middle Mile program. Next slide, please. So under the Digital Equity Act program, there's three grant programs. The first is the $60 million state planning grant program. This was open to states, the District of Columbia and Puerto Rico, for them to develop their state digital equity plans. This is the roadmap, what I like to call the people's plan for that state and how they will close the digital divide and achieve digital equity for their states. The second funding is the State Capacity Grant Program, which is the $1.44 billion for states to implement the digital equity plans that they developed in the planning grant program. And then the third program is the competitive program, which is the $1.25 billion. This is for not only, state agencies, but political subdivisions, nonprofit organizations, local educational agencies, workforce development organizations can all apply directly to NTIA for funding. Across all three of these programs, there is a set aside, 1% set aside for territories, and a 5% set aside for what we refer to as Native entities, which are collectively our Indian tribes, our Alaska Native entities, and our Native Hawaiian organizations. So, as of now, all 50 states, the District of Columbia, and Puerto Rico, and actually all 4 territories have developed their state digital equity plans. The 4 territories are in the process of having their plans reviewed and accepted by NTIA, but all 50 states, DC, and Puerto Rico have had their plans reviewed and accepted by NTIA. On March 29th of 2024, NTIA made available more than $800 million of that $1.44 billion state capacity grant for states to apply directly to NTIA for implementation. So next slide, please. So with the social determinants of health, next slide. When we are approaching our work, we like to take a public health lens approach to how we're closing the digital divide. So the question we like to ask is, how does the meaningful use of technology improve the following outcomes? And one of the domains, and we look at the intersectionality of the 5 domains of the social determinants of health, and one here in particular for this conference is around the social and community context, and really looking at how can access to the internet help promote social connectedness. And so we know that access to the internet doesn't cure everything, but we do know that without access to the internet, it does impair our ability to help improve lives. And so when we're looking at access to the internet, how can we promote people to remain connected to each other? Because we know that through social connectedness, it does help stabilize and provide the supportive relationships that people need in order to live longer, more healthier lives. And this is so important when we think about our aging population, as well as our individuals with disabilities, being able to make sure that they have access to the internet so that they can connect to their loved ones. One of the ways that we can measure how we're improving this is looking at, how can access to the internet ensure that someone has at least one other resource or individual or person that they can connect to for support. How can we ensure that people have access to know where those safe public gathering places are at, so that they can even, connect to, other people. So, and we know that through promoting social connectedness, people are able to, remain in their communities and be able to thrive. One of the things that I have learned in the travel around the country, when you look at economic stability, for instance, so many families have had to move away from their communities in order to advance economically. Through access to the internet, individuals are able to remain within their community and have access to remote work opportunities. This helps to maintain and promote and preserve the social connectedness that they need in order to thrive. And so this is one of the outcomes that we are measuring and looking at, how can we be more thoughtful and intentional about promoting, utilizing the internet to promote that connection, that human connection that is so needed. Next slide, please. So here are some outcomes that we know that access to the internet can help promote. So when it comes to economic stability, you heard me kind of talk about like the increased employment and economic outcomes. I was just actually, increasing food security, which is the opposite of food insecurity. And on Sunday, I was actually at a community garden. And so those are opportunities where, individuals from the community can come because you can, find those apps, use the technology to find where those gardens are at and be able to connect with folks, as well. Next slide, please. And so specifically, I'll talk next about the capacity grant program. The funding opportunity is open right now. Next slide, please. So as I mentioned earlier, under the State Digital Equity Capacity Grant Program, states right now are applying to us, to NTIA, to submit their plans of how they will implement the digital equity plans that they developed under the previous program. So they are identifying, how they're prioritizing the funding that they will, use during this implementation. And their goal is to achieve digital equity. And so here is the definition. I always like to, include the definition for digital equity, and that's to create the conditions where individuals and communities have the information technology capacity that is needed for full participation in the society and the economy of the United States. So when we talk about conditions, one, it's making sure that access to affordable, reliable internet is available. Two, making sure individuals have the internet-enabled devices that meet their needs. And that can look, different, by the person. And then the third is to make sure that they have the skills and the resources to meaningfully use the internet so that they can fully participate in the society and the economy of the United States. So under our program, we have 8 covered populations. One of those who are low income. Second are aging individuals, age 60 and over. Incarcerated individuals as defined by the states, but not those in federal correctional institutions. Our veterans population are individuals with disability, are individuals with a language barrier, including our English language learners, as well as those who have low levels of literacy, individuals who are members of a racial ethnic minority, and then individuals who primarily reside in a rural area. Next slide, please. I really like to show this slide because it reflects the intersectionality of our covered populations, recognizing that no one covered population is a monolith, but that individuals may have multiple identities. And so, we really encouraged our states to disaggregate the data and really look at the multiple intersections of individuals. So for instance, you can have someone who's an incarcerated individual, but if they are incarcerated and they have a disability, the needs of that individual will look different than the general population. And so it's so important to recognize those disparate needs so that you can identify the appropriate solutions that really meet the needs of that individual. Next slide, please. And I mentioned earlier the BEAD program, and I like to show this slide because states are required to integrate their BEAD plans with their digital equity plans. So under the digital equity program, we have 8 covered populations that I touched on. Those are all the ones in blue. When you, under the BEAD program, you take all 8 covered populations and you add in the red, and they represent, they include all of the underrepresented communities within the BEAD program. Next slide, please. And so this touches on, as we're serving our covered populations, our goals to have, the impact. So I touched on like the economic and workforce growth, making sure that individuals have those access to those job opportunities, the importance of educational impacts, making sure that individuals have accessible learning and upskilling opportunities that really meet their needs. We know that with increasing access to the internet, coupled with the meaningful use, that individuals will have more control over their health. We want to, empower individuals to increase their health literacy so they can be their own advocates for their health. And of course, with the increase in improved civic and social engagement, and as well as getting access to essential services. When I was in Arizona, I had an opportunity to help support in a digital literacy class for seniors on a tribal community. And so I was helping the seniors learn how to use Zoom so that they can remain connected to their community and be able to participate in community meetings. Next slide, please. And who are eligible for the capacity grant program? So right now, states and territories are eligible for our capacity grant program. And so they're the ones who have received the funding from NTIA to implement their funds. After we make the first award under the capacity grant program, we will then launch the competitive grant program, which will open the application pool for other for organizations, other than the states. Next slide, please. Next slide, please. And so key dates and deadlines to think about. So states have until May 28th to submit their applications to us. And I really want to note for you not to wait until the competitive program, but to really reach out to your states now. Because while the states are submitting their applications to us, they have up to 9 months after they receive their award to identify the specific projects that they will fund in order to implement their plans. And so it's not too late to reach out, to your states. Reach out to them. I encourage, if we can go to the next slide. Let's see, I should have some links here. Here we go. Okay, so here's some information for you. So under bullet 2, while I'm talking about it, so if you go to our Broadband USA site, you will find links to the state digital equity plans. I encourage you to go to that site, read your state's plans, and see where you show up in your state plan. States had to conduct a needs assessment and asset inventory, develop measurable objectives and goals around each of the 8 covered populations under our program. So see where you fit. If there are services, interventions that your organizations deliver that aligns with the state goals, those are opportunities to share with the states the work that you're doing. If you find some gaps in the state plans, it's not too late. States can use up to 20% of their capacity grant program to update or maintain their plans. So make sure you connect with your state to ensure that your voices are reflected, in the state plans. If you are looking for the contact information for your states, go to the internetforall.gov website. If you click on the map, it will provide the contact information for that state broadband officer. It will also provide the contact information for the NTIA federal program officer that serves that state. So often people say, they tell you to go to get a seat at the planning table, and you don't know where the planning table is at. But here at NTIA, we are making sure that organizations and people know where the planning table is for the state so that you can be a part of that planning process. If you have any questions following this conference, please feel free to email us at digitalequity@ntia.gov, and we will respond to your questions. I'm actually on the other side of that email. And so I will see those questions and we'll make sure that we respond to them. Also, I encourage you to sign up at our Broadband USA website. You can sign up for our newsletters so that you could be made aware of any webinars that's available. And I encourage you to participate in those webinars as well. And when we launch the competitive program, we'll also have webinars around the application period as well. And if you go to that website and you click under resources and technical assistance materials, you'll find a whole host of materials available for you to access as well. And that concludes the presentation, and open to questions. Katie?
Wonderful. Thank you so much, Angela. That was a really, really helpful presentation, and just very grateful for you to share that information with our network today. And it is just so great to see that people with disabilities and also older adults are included in the covered populations for these grant programs. And again, I really appreciate you advocating for attendees to really engage with their state around these plans, and to do so through partnerships. What would an effective partnership look like with a state in making the case to really be inclusive and thoughtful of connecting older adults and people with disabilities?
I think so. What I would recommend, one, is reviewing the plans. I know that these are lengthy plans, but because they're meant to be comprehensive, I think an effective partnership is to identify, one, create a coalition. We're stronger together. So, having organizations come together with their respective strengths and being able to come to the state and say, hey, you know what, we've read this in your plan, and we as an ecosystem, as a coalition, feel like collectively together, we can help the state, advance these goals. One of the challenges that states had during the planning process is getting access to data. Finding that baseline data around what are the needs, because just in full transparency, we have, our population viewer, but it was at such a high level, and states were looking for more granular data around the different communities. So that is a huge gap that states, I think, would welcome, partnerships to help them, really fine tune the baseline data that's in their plans to make sure that we are reaching, those individuals who need to be served. I think it's around coordination of resources. During the pandemic, I was boots on the ground as well, and I felt like an overlap of services and not enough coordination. And so you had communities that was, over-resourced, and then you had other communities that didn't receive any resources at all. So I think the more that we can coordinate together to make sure we're not duplicating, so that we are serving all of the different pockets of communities that need it most.
Yeah, that's really helpful. And can you share a little bit more about how states are identifying people who are in need of internet connection and what that process has looked like? I agree, data collection is so important here, and I'm sure folks will really benefit from seeing the data in the state plans as well.
Yeah, so I touched on the BEAD program, kind of at the top of the presentation. Right now, a lot of our states are in what we call the challenge period. And so the funding that the states received was based upon the FCC's map of, who didn't have service, right? And so what the states are in the process of trying to do is to reconcile that map and basically correct it. It's some maps show that folks are served, right? But then they're not served. And so the state is really in a quest to correct the data and make sure that they are identifying those households who don't have access. So we know that if we, first of all, don't get access to the home, that it will be challenging to even bring the internet-enabled devices, won't work for the individuals in the home, as well as, getting the services, that they need. So one way is to, when you go to our website, not only will you get links to the digital equity plans, but you also will get a link to the BEAD plans and the challenge grant, the challenge process, for the state, because we need to identify every single household that does not have access. The other way that the states have been trying to identify the needs is they've been on tours, engagement tours, going around the state, holding stakeholder meetings. They've been conducting surveys. I would just encourage you to, be involved in that process. Just because the planning grant process is over does not mean that the engagement is over. States are required to share how they will remain engaged with the community through this implementation process. So as they're implementing the interventions, what is their feedback loop? How are they, being informed of the effectiveness of the interventions and what pivots they need, to make as they're implementing these programs? So it's so important to stay engaged and to stay part of it, because we know the best well-laid plans, until you start to implement it, you have to make adjustments. And so it's important to be at that table to help inform the state and really be, these co-creator of the solutions for your communities, because you know best what your needs are. It's just important to make sure that those needs and those solutions are articulated, and up to the states.
Absolutely. The Aging and Disability Network is so strong and expansive. So I'm just so glad we're sharing this information with them. And you also mentioned the competitive grant program, and this seems like an additional opportunity that really fits with the type of organizations and professionals in the Aging and Disability Network. Would you mind sharing a little bit more about the timeline for that and how folks can kind of track that opportunity and eventually apply for it?
Yeah, so I can't give you specific details on the timeline, but I will share that after we, make our first award under the capacity grant program by statute, we will launch that program, afterwards. But to stay abreast of the timeline, I would encourage people to go to the Broadband USA website and click on the subscribe now and subscribe to our newsletters, because as soon as we launch that program, you will receive, notification. So just encourage you to go to our website so that you can, remain abreast.
Wonderful. And we'll make sure to capture these links and resources when we share out the links for the summit. Angela, what final advice do you have for us as we strive to increase access to affordable, reliable, and also high-speed internet for all populations, especially people with disabilities and older adults?
I think what you're doing now, coming together, sharing resources, as you think about one, making sure that you're going to the states, because while you're waiting on the competitive program to launch, states can sub-grants funding to, help implement their plan. So you have an opportunity to also engage with your states in the meantime. And I always say that we're stronger together. So forming the coalitions and the ecosystems to ensure that the individuals that you serve are being met, I think is something to continue to do as you're preparing, for our competitive launch.
Wonderful. Yes, I agree. Partnerships are everything, the way we succeed together. So thank you so much for joining us today. I will now turn it over to my colleague, Lori Gerhard, who will be introducing our panel and our next speaker. So thank you so much, Angela, again.
Thank you, Katie. Take care, everyone.
Thank you, Katie and Angela, and what a great session. it's good to learn about these opportunities and to increase digital connections across the country. And I want to encourage everyone to be sure to take a look at your state, territory, or tribal plan and find ways to get connected to your broadband offices within the states. We know that the people with disability population, older adult populations are part of the covered populations, and we encourage you to make these connections. Now we'd like to introduce the social engagement, education, and assistive technology session. Making meaningful connections includes having the assistive technology to interact with each other and creating a culture of inclusion. During this session, we'll learn more about these strategies. Assistive technology can include an array of devices. They can include devices that enable people with hearing, no or low vision to be able to see what's in front of them by verbal descriptions through apps. They can include ramps, so individuals who are unable to navigate steps may be able to leave their homes and travel to engage with other individuals. And they can also include opportunities for people with no hearing or hearing loss to be able to engage with others. And so these are just a few examples. Today we have 4 distinguished speakers that will be joining us. First, we'll hear about a partnership in Wisconsin from Ms. Dawn Mirth Johnson, an education consultant in Wisconsin, Department of Health Services, and Ms. Laura Plummer, who is the statewide Assistive Technology Program Coordinator in the Wisconsin Department of Health Services. Ms. Mirth Johnson and Ms. Plummer will share information about an education and assistive technology partnership in Wisconsin. Next, we'll be joined by Ms. Glenna Wright Gallo, the Assistant Secretary for the Office of Special Education and Rehabilitation Services in the United States Department of Education. Assistant Secretary Gallo will share her personal experience and highlight steps the Department of Education is taking to increase access to assistive technology among students with disabilities. And our final speaker will be Ms. Laura Talmas, who is the Executive Director and co-founder of Beyond Differences. Ms. Talmas will share information about Beyond Differences, a social inclusion strategy for school districts and communities. So we're going to switch the order around a little bit. So we're going to go right to Ms. Laura Plummer and Ms. Dawn Mirth Johnson. If you'll bear with us just a minute here, we're going to move through. There we go. Thank you all.
Okay, thank you very much for having us today. We're excited to be here and tell you about what we have going on in Wisconsin. My name is Dawn Mirth Johnson, and I'm going to get us started today. So if you can go ahead to the next slide. So what we want to talk to you about today is how Wisconsin utilized a multi-agency partnership and leveraged federal funds with this cross-agency collaboration to improve the assistive technology knowledge, skills, and resources in our state, as well as identify some strategies and funding opportunities so that we could utilize grant funds and support assistive technology projects across the state. And we're hoping that you can use this as a model in your states to creatively utilize funds that you have. So we're going to talk about the partnership, which involves the Department of Public Instruction. I'm an employee of the Wisconsin Department of Public Instruction as an education consultant for both speech and language and assistive technology. So DPI created the AT Forward project. We contracted with one of our 12 Wisconsin Cooperative Educational Service Agencies, or CESAs. We coordinated with CESA 2 to help manage the grant and run the AT Forward project. We also collaborated with WISTech, Wisconsin Assistive Technology Program, which Laura will tell you a little bit more later about that program. But what we did is we merged our AT lending library with WizTech, which is our statewide lending library through the Wisconsin Department of Health Services. And then we also co-opt with the Weissman Center through their Communication Aids and Systems Clinic, or CASC, and they are part of the University of Wisconsin Hospital and Clinics and Rehab Department. So we'll move on to the next slide and tell you a little bit more about how the funding works. So this actually started, looking back in the history, Assistive Technology Act in 1988 to 91 formed the creation of WizTech through DHS. And so that's kind of actually the start of where the funding stream began. But you'll see as we move forward that our AT Forward project didn't start till quite a few years later. So Wisconsin was home to WADI, the Wisconsin Assistive Technology Initiative, that was formed in 1994 and started I think putting Wisconsin on the map a little bit more for assistive technology. And then in 2008 was the launch of Wisconsin AT for All, which Laura will describe in a little while. The Department of Public Instruction, this was prior to my employment here, but they were talking for a number of years about a way to bring assistive technology forward in Wisconsin. And 2020, one of the silver linings was the CARES Act, which allowed them to utilize that funding to form this group. As of 2022, we've continued funding the discretionary grant through IDEA funds. And next slide. So our project has a number of components. We have the AT Forward community of practice, and also more recently an online community as part of that practice. We have a video resource library where we have, in alphabetical order, videos of all of the AT Forward Connection meetings. And then we have micro-credentials. I'll explain those in just a little bit. And then the Wisconsin AEM, or Accessible Educational Materials Center. And we have AT devices, services, and resources as part of the project, and then an AAC partnership program. So our AT Forward project works with self-advocates, educators, practitioners, caregivers, and families to increase student autonomy in utilizing assistive technology tools and to support access, engagement, and progress in learning. And now I'll talk a little bit more about each of the components and then turn it over to Laura to finish. So on the next slide, you will see a little bit of information about our AT Forward connections. We have free monthly community of practice meetings for families, educators, and professionals at any level of knowledge in assistive technology. We also have monthly email updates and resources that are available to anyone out in the field. And then we have the video resource library. So we store information in that library from those monthly community of practice meeting recordings, and have a topic list so that people can easily access what part of AT they are looking for more knowledge on. We also have the AT Online Community, which is a new development this year. It's in conjunction with our Universal Design for Learning, or UDL community, and it gives people another chance to connect more socially. Currently, our statewide meetings have our community of practice has over 1,300 members, and we are serving over 270 unique school districts in Wisconsin. So we're really doing a good job, I think, reaching a lot of different districts, and we have more that we need to reach out to. On the next slide, you'll see more information about our micro-credential program. We started our badge program just a little over 2 years ago. There's no cost to participants, and we use our videos from the community of practice as well as the ATIM modules for the learning pieces. We offer a macro badge for those who complete 7 or more badges. We have 2 members who have actually completed all of the micro-credentials that we have available, so that's pretty exciting. To date, over 374 badges have been issued. And we have 19 different content categories available. And as you can see on this chart, it's probably a little bit small for you, but AAC or communication has been our most popular, but we have really grown where people are seeking out information in a lot of other areas. And then the next slide. So the Wisconsin AEM Center, or Accessible Educational Materials Center, was also developed as a result of the grant. We have added to that center. It's a point of contact for educators so they can seek support and acquire accessible materials for students with IEPs or individualized education programs. The Wisconsin AEM Center has published several statewide resources, including the decision tree for IEP teams to use, a next steps guidance document, and also a 4-part webinar series around the requirements of AEM. And then the next slide will tell you about our AAC partnership program. So this program is a joint project between AT Forward and the Communication Aids and Systems Clinic, or CASC, at the Weissman Center of the University of Wisconsin-Madison. It provides learning opportunities for school teams to improve their capacity to assess, match, and provide special education services to students who require AAC. And we have students, families, school teams that include a variety of professionals, community teams that are enrolled in the CASC Center and work with DPI as part of the grant. We have had 22 families enroll in this program with a 95% retention rate so far. We have 5 students who have received personal speech generating devices, 3 that are currently in the submission of paperwork for purchase, 3 in a rental period, and 5 in triage currently. So again, we're trying to reach more and more students through this AAC partnership program. We have 17 school districts and 8 out of our 12 regional CISAs represented. What we're trying to do with this partnership program is build regional champions where schools and teams can complete their own AAC evaluations at the district level or at the CISA or cooperative agency level. And now I will turn it over to Laura for the next part of our presentation.
Thank you, Dawn. So our 6th component of the AT Forward project is the AT devices, services, and resources. So prior to AT Forward, WISTEC, Wisconsin's ATAC program, we maintained a public-facing website with all of the devices and tools that are available statewide for short-term demonstration or loan through WISTEC. And we reach all 72 counties with our programs through our subcontractors. And on the other side, the AT Lending Center through Department of Public Construction had their own website for borrowing equipment. And so the two did not meet or merge. So one of the project's first tasks was we enveloped the AT Lending Center from Department of Public Construction into our Wisconsin AT for All. And what we found by doing that is that actually increased the number of loans that went out to school-based districts and educators. It more than quadrupled in the first year by having a broader base and exposure through the WISTEC AT for All. And on the flip side of that, it also created more awareness for families as well as educators as to technology that's available beyond just school-based. So they started to learn about daily living devices, environmental access, adaptive gaming, things that may not be covered through the education process. And so on the map, on the screen is just a map. Part of the AT Lending Center is a map that's clickable for each county that will provide a contact for the local independent living center, the Division of Voc Rehab, as well as other resources. So it really strengthened a family and educators' ability to find the resources they need on a statewide basis. And next slide. So as we began this whole process of developing the collaboration between Department of Health Services and Public Instruction, it goes back many, many years. But the first step was really understanding the system. So understanding and identifying, who the decision makers are, what are the barriers, who's involved, and then how are decisions made. So as an example, at the educator student level, we have barriers to accessing education. We may have barriers to the buildings, which takes us to that building level. So what are the systemic things that are happening that might be a barrier for an educator, their family, and the students? And then we have our district level. So that's usually our policies and procedures. We have our state level, where we have our state Department of Ed, but we also have Department of Health Services, voc rehab, we have legislators, we have professional organizations. And then at the federal level, we again have our policies, we have our legislators, and the regulations. So we needed to understand how all of that encompasses and impacts that social integration and learning about assistive technology. So next slide. And part of also this was educating and sharing information with the community at large, with our schools, with our families, that AT is a process. It's not a destination. So what can we do as a collaborative effort to create access? How are we sharing information? How are we getting it out to people? How are we creating the more public awareness and the trainings? Where's the opportunity for people to try the equipment, see if it works, see if it doesn't? How can we help them understand the acquisition? Is this a school provided device? What are the funding resources for a family? Are there used equipment available? Or is there state financing? So helping get that concept, it's not just from point A to point B. There's a lot of variables that come in to play, from learning about the device to obtaining the device. And it's ongoing. And next slide. And so just a few wrap-up slides here, just to kind of our approach. One arm was our advocacy. So AT Forward sat down, we looked at where is the money coming into our state, what agencies are receiving that money. Luckily, we had CARES Act, as Don said, it's a silver lining. And then through that, our work group really felt empowered in order to move forward, set goals, develop those ideas, and then launch those ideas. And next slide. So for you in your state or your programs, it's really taking a look at how can you cultivate those connections. So looking and connecting with your state education agency. If you're an ATAC program, how can you better align with your state education agency? How can you better align with the professional organizations such as Council for Exceptional Children? On the flip side, as an educator, how can you engage with your ATAC program, which is a national program, every state and territory? As we look at future development, so our teachers need to learn. They need to understand technology. So how can we integrate into teacher prep programs, develop AT labs on campuses so our special educators hit the ground running and understanding AT? And then there's so much beyond school that we also have to think about what are the resources for families outside of education. Is it your library? And then our strong partners of our independent living centers, as well as our aging and disability resource centers. So how can we connect all of those together and really help build that knowledge base so that everyone does have access to AT? And I believe that was our last slide. So thank you very much. And I will turn it over to Glenna.
Thank you so much, Laura and Dawn. And Glenna will be joining us in just a minute. We're having a little technical difficulty here. So if you just give me 1 second, we'll see if we can get her on the phone. While Glenna is working to connect, we're going to go ahead and move on to Laura Talmas. And thanks for the icebreaker work in the chat. We appreciate that. We'll turn over to Laura Talmas from Beyond Differences. Laura, the floor is yours.
Thank you so much. I hope you can hear me properly.
Yes, we can.
Great. Such an honor to be here today. We're going to move to the first slide, and I'm excited to share with you a little bit about my nonprofit organization. Our name is Beyond Differences, and our mission, as you could read from the screen, is to end social isolation and create cultures of belonging in middle schools across the country. We were the first nonprofit in the United States on a grassroots level to identify adolescent social isolation as a public health crisis. And we began back in the day, way back 14 years ago in 2010, when no one was really talking about youth. But in fact, most of the federal and even international research that I could find was pointing towards seniors and the elderly and the really consequential effects of social isolation on that population. So I understand the importance of all of the services that grew up around servicing the elderly community, such as pet visiting services, transportation services, food delivery services. But in fact, nobody was talking about children back in the day, and there was very little recognition on a mass basis. So why did we get started? Next slide. This child, my daughter, Lily. Lily was born with a rare craniofacial anomaly. And while that disability was structural, and it didn't affect her intelligence or her personality or anything else, it really did affect her social life, especially in middle school. And we could talk in a moment about how some of us get through middle school a little bit easier than others, but I think we can all agree that those adolescent years can be very challenging, especially at school. Tragically for our family, Lily passed away in her sleep at the age of 15 and a half as a freshman in high school. We were devastated, and I don't think in those days there was any sense that I would wake up a few months later and think I had nothing better to do than to start yet another nonprofit. But a group of her former classmates and even some childhood friends came together and asked what they could do to honor Lily's life. And since we had struggled with Lily during her middle school years, to keep her in school, and eventually made the tough decision to pull her out of school, I thought, why not grab this group of kids and see if we can present an assembly program and talk about their own experiences, maybe with social isolation, or maybe just they could commit that they would never want other children to come to school every day feeling the way Lily did. And they were all game for that experience. And that is literally how we got started, was one assembly after another. Lily used to call me from the girls' bathroom when she was in 6th and early 7th grade, crying that none of the other girls or kids, frankly, wanted her to sit with them at lunch. And she just wanted me to drop everything and come pick her up and take her home. Of course, as her mom, I was devastated, and there was just so much time that you could spend listening to your child suffer before we did make that difficult decision to pull Lily out of school. Next slide, please. Today, we understand so much more about social isolation, and those of us who are experienced in the field can know that it can manifest in many ways, but our staff, made up of PhDs, former teachers, classroom educators, etc., define social isolation as physical social isolation, or the experience of loneliness, the gap between the desire for connection and what we actually experience, and then being in a group of people and actually not really feeling like you're being seen or included. And that happens quite frequently with children. Next slide. So here's what we do and the craziness of how we grew, quite frankly, because we're talking about 14 years of a journey. That one assembly program resulted in teachers asking us if we had any curriculum to offer them after our assembly program was finished. So over the last many, many years, we've developed very sophisticated middle school grade curriculum. Everything that we offer, by the way, is free. My husband, who co-founded the organization with me initially, and I both decided that we did not want teachers to pay for materials out of their own pockets. And so we have been able, on a philanthropic basis, to raise enough money to keep ourselves going over these last 14 years. So we do not charge for our curriculum or our National Days of Action. So we export curriculum in the form of teacher guides that come out 3 times a year. Our fall program is our back to school program called Know Your Classmates, which, as you can tell from its name, allows children with their teachers to get to know one another at the beginning of each school year, especially in 6th grade when children may be moving into middle school from many different elementary schools. Know Your Classmates is a powerful curriculum. We have No One Eats Alone, which is our winter program, and we celebrate No One Eats Alone also with lesson plans right around Valentine's Day, which symbolically, when I was growing up anyway, might have been the day where if you didn't get lots of Valentines from your classmates, you could feel sort of left out. So No One Eats Alone is what Lily went through, and that's our flagship program. And then we end the year with Be Kind Online, which deals with the behavior of children online that causes social isolation. Each one of these packages has teacher lesson plans, small 5-minute belonging boosters for teachers to use. It has a student leadership guide, and it also has a 1-day celebration, which we hope children themselves will actually organize with the help of a faculty champion at their school. So that's what our days of action are called. Next slide, if you don't mind. From the very beginning, we were student-led, and we are committed to having student voice be centered in everything that we offer other children across the country. So we do that by having a high school teen board of directors, which is made up of about 45 high school students that are volunteers. Now that we're national and we are in 10,000 schools in all 50 states, our teens come from many, many different states. And so they do meet virtually once a month, but we bring them together for 4 days every summer for an activist academy where they get training on leadership, public speaking, and they actually write curriculum that's used in the following school year. This summer, at the end of June, we're all going to be flying the children free of charge to Atlanta so they could be staying at Emory University and attending our activist academy. Next slide. The kids themselves come up with the issue areas that they feel are most important to younger students in schools across America. So they come up with their own teams, and then they volunteer to serve on one or multiple teams. Here are the 6 different topics that the children have picked out: LGBTQIA+ rights, stopping AAPI hate since the COVID pandemic, positive body image, dealing with the advent of poverty and economic development and how that makes children feel socially isolated. It also includes community violence, centering immigrant and refugee voices. There are almost 25% of children in America today that are first generation immigrant students, and then disability visibility, which is one of, ironically, the reason why we got into this was because of Lily, but we've really expanded so far beyond that. And yet here we are today talking about the importance of disability visibility, and the kids picked this as a topic themselves. So we'll move on to the next slide. We know, and again, for our purposes, that we have over 10,000 schools in all 50 states that are using our free curriculum. 64% of our schools are considered Title I, which are federally subsidized reduced lunch program. And so we're very proud of the fact that we're really meeting children and the American families where they are. As I mentioned, our teen board themselves are majority BIPOC children, so they have lived experiences that's reflected in the curriculum that they help create. And our disability visibility curriculum, which we'll go deeper into in a moment, is helping to serve what we think might be 15% of children attending schools with a defined disability, so that they can then help empower classroom norms and school-wide policies. Next slide. We have champions all over the United States. This is a photograph of California Governor Gavin Newsom, who himself grew up with dyslexia, which was quite debilitating for him, both socially and academically. He's talked on video many times for us and for others, and he even wrote a book, a children's book called Ben and Emma's Big Hit, about a little boy with dyslexia. And the photograph on the right shows him coming to a public school in Sacramento, California, about 2 years ago in celebration of Know Your Classmates Day, where he read the book to a whole class full of children. And then we had 2 of our own teen board members asking the governor questions. Next slide, please. So this is a photograph of one of our teen board gatherings, and their assertion is that everyone at one point in their lives will be part of the disabled community, whether it's for a moment or a lifetime. So many young people experience social isolation due to growing up disabled themselves or with a family member, and many of our high school teen board leaders actually have family members that have disabilities, and therefore it affects them. This photograph buried in here in the middle is California State Superintendent Tony Thurman, who's the head of public instruction for California. Next slide. This is a photograph of the kids who volunteered to be on the disability visibility curriculum team. Next slide. So without having to read any of this, there is all available on our website, and I'll be able to give you the link at the end. All you have to do is just sign up and you'll be able to get access to all of our curriculum. But the kids really worked very hard at putting together this curriculum. And at the center of it are 3 teen board members who each shared their personal story, and we call them their own superpowers about what makes this issue very important to them. Our curriculum for educators and for parents alike, quite frankly, school districts on down to the individual classroom, really centers around a prompt question that could be used as an opener or a closer for the stories that the teen board members share. Also, if there are clubs or other advisories or leadership groups at the school, these could be used for affinity groups as well. Our website is full of ways in which we can celebrate without shame, blame, or hopefully allowing children to withdraw who has a disability. You know, one anecdote that I remember so powerfully was from an educator who wrote me after our assembly program at their school to tell me that immediately after our group left, they went into a lunch break. And for the first time, a child who had been coming to school in a wheelchair with a personal aid their entire high school career, the aide was able to step away from the child and have the child mingle with a group of their classmates, but that had never happened before our group came and presented an assembly. So in terms of raising awareness, opening up children's hearts, appealing to them at the right time of developmental access. Middle school is perfect. Yes, in an ideal world, we start earlier. But again, this curriculum can be used at the dinner table or in cars or subways with your child or your grandchildren, just to be able to raise their awareness about what it would feel like and look like for them to include others in their school, at their school. But our curriculum really does amplify youth voice. Everything that we do centers the student voice, and the teachers have to be the champion and bring the programs in, but they're very easy to implement, even though I realize that class time is precious and school time is precious. So these could also be used in the after school or expanded learning space. Next, please. We also started looking at ourselves as an organization and wondered whether or not we were walking the talk, as they say. And we began to realize that we had more work to do to be our own authentic selves and to require adults that were working with us, either as guest speakers, because we have a very robust adult professional development department. And we bring in guest speakers all the time. We really wanted to be sure that we were adhering to the best practices of accessibility guidelines and practices, if you will. So we hired this young woman by the name of Erin Robbins, who had left teaching because she just determined that she could not work in what she thought was a broken system that continued to label children with disabilities as themselves broken. She has a hearing impairment, and she understood all that well what it meant to go to school. With her master's degree and her extra credentials, she became a private consultant in accessibility design. We hired Erin for a one-year contract, which just wrapped up a few months ago, and we created what's known as our first version of our accessibility guidelines. So on the next slide, it's a huge document. It's about 64 pages, but basically, as I mentioned before, it ensures that our own staff and all of our guest presenters have their own training materials and their communications, whether it's marketing material, flyers, or whatever, aligned with best practices for persons with disabilities in order to build true cultures of belonging. We broke the accessibility guidelines into 3 components: required, requested, and recommended. Required is what it sounds like. We really do require presentations, regardless of the audience, to adhere to the best practices, and our presenters even sign a contract to make sure that they will do so. A request is not mandatory. However, we believe that adhering to these guidelines will increase access to our teachings for a broader audience. And a recommendation, unlike what it sounds like, isn't just a nice to have, but rather an opportunity for our presenters to build their own capacity towards developing more inclusive materials. And I'd be happy to share with you some of the learning that we gleaned from working with Erin for the past year. So some of that is available on our website, but it's not quite ready for publication yet. All in all, I'd like to say that we're very blessed to have been in this field for 14 years. I had no idea that I would become the executive director of what has now become, quite frankly, started out as a grassroots movement to talk about my daughter, to talk about how other children might feel the way my daughter felt. And now we really are recognized by such luminaries as the United States Surgeon General, Vivek Murthy, who actually honored one of our own high school teen board members last fall at the Kennedy Center as he gave away the highest civilian honor the Surgeon General could give, which is the Medallion of Health. He honored Alicia Lee, who's a graduating senior going to NYU this fall, with her honor, as she had created a paper crane project that was sent to over 10,000 schools across the country to help other AAPI youth stand up against the hate that she and her family were feeling as a result of some of the unfortunate rhetoric that our country hears all too often and how it affects children. So the Surgeon General is a great friend. We're so honored to be part of his recommendations that all schools across the country should have programs like Beyond Differences in their schools. So if you'd like to bring Beyond Differences to your school or your community, or you're a parent or grandparent listening to this presentation, it's just as easy as could be by signing up on our website. I'm going to conclude by showing you my thank you slide, and our website is right there. Lots of ways to get in touch with me and with us. So thank you so much.
Thank you, Laura. And I believe we've got our technical problems worked out. And now we'd like to turn to Assistant Secretary Glenna Wright Gallo.
Thank you so much, Lori. Is everything working? Can you hear me and see me okay?
We can hear you. I don't know that we can see you, but we can definitely hear you. Oh, we can see you too. We can see you. We're going to pin you in just a minute, and the interpreter is visible too.
Great. Well, thank you so much. I am very excited to be able to spend this time with you today and have had an opportunity to listen to the other presenters talk about the valuable work, and want to thank you for everything that you do on behalf of individuals with disabilities. Part of the work that I get to do is the Assistant Secretary of the Office of Special Education and Rehabilitative Services, or as we affectionately call it, OSERS, at the Department of Ed, is really focused around advancing the mission of the Secretary of Education, Miguel Cardona. On the next slide, he's leading out with an initiative called Raise the Bar, Lead the World. And I think it's so key in the conversations that we're having this afternoon when we think about social connectedness and the use of assistive technology and removing and reducing barriers for learning and accessibility for all individuals, including those with disabilities. So part of the Raise the Bar, Lead the World initiative is really keyed in around three areas: achieving academic excellence, boldly improving learning conditions, and creating pathways for global engagement. And when we think about the need for us to be socially connected, and we think about the research that has come out of the CDC around social connectedness and the impact on our health as adults, but also as youth, we know that it's even more important when we build learning systems that we think about ways to connect children. And so we also think about not only social connectedness, but connectedness to school and how we reduce barriers in order to do that. So one of the things that I want to talk to you about is for individuals with disabilities, but it impacts all students, is how it is that we can build systems that accelerate learning, deliver comprehensive and rigorous education, making sure that we support the educator pipeline so that we have educators coming into the system, but that we also provide them with the mentoring and the support from school leaders so that they stay in the profession and continue to impact the lives of our youth. And part of that is going to be really investing in mental health and well-being. And one of the things that's so meaningful to me as an individual with a disability is when we think about the ultimate goal is creating pathways for global engagement. And in the Individuals with Disabilities Education Act, we talk about preparation for life after school, for post-secondary education, employment, and independent living. And the language that the Secretary uses and that we see in the Every Student Succeeds Act is ensuring that every student has a pathway to college and career. And for individuals with disabilities, we want them to have more opportunities, not fewer. So when we think about social connectedness, we can see that through each of the pillars, right? The academic excellence, making sure that we have that inclusion, that we're reducing barriers and making sure that children with disabilities have an opportunity to meaningfully engage with non-disabled peers and access and move forward in learning. When we think about boldly improving learning conditions, we really want to make sure that we have educators and school staff who are prepared to help children connect to school and socially, and that we have supports around their mental health and well-being. And then when we look at those pathways for global engagement, we want to look at how do we connect students to the variety of the world around them with different pathways to college and career that meet their needs, as well as making sure that we really build in and lift up multilingualism, especially since a large portion of our population are learning English as a second language. So the work of OSERS is really on the next slide around a main mission in our field, and it's to improve early childhood education and employment outcomes and raising expectations for all people with disabilities, their families, their communities, and the nation. And I like to say this is really about improving outcomes and raising expectations. And our work at OSERS starts with our youngest infants and toddlers and goes to adults in the workforce with the support of the Rehabilitation Services Administration, or RSA. So we're focused around 5 main priorities, all geared towards leading for equitable outcomes. And these things are not going to surprise you, right? It's having a prepared workforce. It's having evidence-based practices that are based on research and evidence basis, such as what we know is happening with social connectedness and school connectedness and the impact on health and mental health. Our third area that we're really looking at is accessible technology. And part of that is making sure that we have accessible educational materials that are able to be used for anyone for learning, that we have assistive technology for individuals with disabilities, and that we're using these skills and resources not only for learning and connecting social communication as well as social emotional wellness, but also that we're taking those skills into the workforce, because we want to make sure that we're prepared not only for the learning of today, but the work of tomorrow, and that our individuals with disabilities are prepared for that. The fourth area that we're focusing on is really stakeholder engagement. And that was highlighted in the previous presentation that Laura just did, really the importance of working together, right? And making sure that we're not making decisions in isolation. And what's interesting is that with the work of OSERS, because we work with special educators and special education leaders, then we have to remind people that we also can't work in isolation, and that we need to make sure that we're bringing in representatives from the general population so that we're building a system that meets the needs of everyone, and that we don't create a siloed system that's designed for and designed by individuals with disabilities by themselves. We want to improve the overarching system as a whole, improve accessibility and improve outcomes for everyone, rather than building a secondary system of reduced expectations and reduced barriers, but then a system that doesn't allow us to function within all components of society in an equitable manner. And then last but not least is something that I haven't heard a lot of conversation about, but the strategic use of resources. And so we know that when we think about accessibility and we think about planning, we frequently think about the cost and the cost of assistive technology. But what we don't think about is how do we reallocate the resources we already have to use them differently and in more effective and efficient manners. And again, for us, this is all geared towards that competitive integrated employment, making sure that as individuals with disabilities leave public education, as they go on to post-secondary education or employment, that they're having an opportunity to interact meaningfully and authentically with people with and without disabilities and be successful. So we're really excited about work that we're doing at the department. We've recently released, just this year at the beginning of 2024, the National Educational Technology Plan. And this plan has been revised for the first time since 2016, but it includes and addresses the needs of all children and all learners consistently throughout the document, proactively, right? And so rather than creating a document and a national ed tech plan that addresses the needs of many of the students, and then we try to retrofit or supplement to address the needs of individuals with disabilities, we've got that built in on the front end to that plan. Now, a companion document to that is also myths and facts around assistive technology for individuals with disabilities, which builds upon the National Ed Tech Plan, but then explicitly addresses the myths that we hear around assistive technology. When do we have to think about it? Who pays it? Who's responsible for it? What do we have to train? What does it have to be used for? Can it go home? Can it go to a job? All of those things that come up frequently are all parts of that secondary companion document, myths and facts. I know I want to give an opportunity for there to be some questions and answers, but I do want to let you know that I just had an opportunity prior to this to be in a session where I was able to talk with educators and students who are using assistive technology to provide instruction and to access learning. And one of the key things that was shared with me that I walked out really thinking about was that frequently the barrier to accessing something is in the design, not in the person. And so I want to encourage all of us to really think about the systems that we're responsible for at every level, whether it's education at an elementary or secondary level, education at a post-secondary level, working in a community, or if you're a family member or a service provider. How do we address the barriers that exist persistently in design of the work that we're doing in order to move forward? And we know that the goal goes beyond access, right? It's not just access to learning, access to the building, access towards social opportunity. It's about really changing the way we do the work and engaging authentically. And that's how we build those social connections that are so valuable to our mental health and well-being. So with that, I'm going to turn it back over to the leadership team so that we can do a Q&A.
Thank you so much, Glenna. Thank you, Laura Talmas, Laura Plummer, and Dawn Mirth Johnson. Thank you so much for your presentations. I think one of the questions that we've heard a lot about is the activities that we can do to really help increase social connections or create cultures of social connections, and also how we can help people discover assistive technology. Laura Plummer and Dawn, you talked about your community of practice where you provide information on assistive technology and also help find assistive technology for people. Is this something that is available to anyone in the country? And if yes, how can people get engaged?
So joining the community of practice is open to anyone in the country, and the micro-credentials. One thing we may need to consider if we have a lot of out-of-state participants is our capacity to monitor the micro-credential program. But currently it is available nationwide with priority to serving our state, of course. And then Laura, the lending library would be in state only, correct?
Correct, but please keep in mind that each state and territory has a federally funded Assistive Technology Act program, which is charged with device loan and demonstration. So anyone can reach out. And I know, Lori, I saw you put the link earlier in the chat. And I always just say, it's like trying on clothes. You know, we've all gone online shopping. We've all like bought a shirt or a pair of pants, and we're just like, oh, that is not for me. So assistive technology may not be, it may be expensive, it may not be, but your funding for it might be a one-time deal. So let's get you the right piece of equipment that's going to meet your needs, because you can't always just send it back. So we just want to make sure it's the right match.
Thank you very much. And Laura Talmas, you were sharing on how schools can create cultures of inclusivity. And thank you so much for your leadership and work in this space. One of the questions that was in the chat was, well, is there training like this available to more than schools and people with disabilities? Because it's something maybe all of us could benefit from. So could you speak to that a little bit?
Yeah, I mean, the benefit of us being in a virtual world these days is that we have an online learning community where really anybody can sign up and join. You don't have to be a classroom educator. We have parents and we even have students who sign up. So number one, you know, avail yourself of everything that we have to offer. All of it is free, and we do adult professional education as well as school signups. Our curriculum can be used as I mentioned earlier, I have a friend who's a grandmother, and one of the things that she asked her little 4-year-old grandson when he was done playing soccer was not how many goals did you score, but who did you pass the ball to? And when you begin with those small little prompts for little children, it's amazing how that kind of teamwork and thinking about others now becomes sort of a way of life for his thinking and the family. So I think we all know that we have precious moments in the car or together with our children and grandchildren, and we should be doing anything we can to sort of raise their sights about behaving more inclusively and not rejecting somebody's identity because you think the way they look is really who they are. I think that's really one of the biggest lessons that I learned being Lily's mom. And I see that day in and day out with Beyond Differences now.
Thank you so much. I know we are short on time. I want to thank our presenters today for the great information that you shared, your leadership in this space. And I'm going to turn things over to Meredith Hanley. Meredith?
Great. Yes. Well, thank you, everybody. I want to thank all of the speakers for sharing their time and their expertise with us all today. I hope everyone has learned as much as I have today. But the learning isn't over yet. We will have day 2 of this virtual summit tomorrow, May 15th from 1 to 3:30 p.m. Eastern time. So that's day 2 of this National Summit to increase social connections for more opportunities to discuss and dialogue and learn from social connection leaders. So tomorrow, just for a brief kind of highlight of what that day will look like, we'll kick off with a spotlight on No Wrong Door Virginia's online social health connector tool, which uses machine learning to support Virginia residents and their social health needs. We will then hear from a panel on the future of virtual programming as we are in this post-pandemic era, with panelists highlighting some varied replicable programming models all around, all that are virtually based. And then we've gotten a lot of questions about, will this be recorded? Can we get access to the chat? Will the slides be available? And the answer is to yes to all of that. Just give us a few days, but it'll be posted on the committoconnect.org website in the next few days. And Katie, I'll pull you in for any final closing remarks that you have.
Yes, thank you, Meredith, and thank you all for joining us for this first day of our National Summit to increase social connections. A huge thank you to our expert speakers today who shared resources, learnings, and insights on how to facilitate social connection for all people, but especially older adults and people with disabilities. I also appreciate the strong interest, the engagement, and the questions from everyone in attendance. Again, social isolation is not an individual problem, but one that is rooted in community design and social norms, systematic injustices. So really together, we must work to advance social connection, to create a culture of connection and improve our nation's health. So thank you all for your hard work and your commitment to this topic. And we so look forward to tomorrow at 1 o'clock to hear more from local, state, and national leaders on this topic. The link that you used today will be the same link you'll be using tomorrow. I saw that question in the chat. And thank you again so much. And we will see you tomorrow at 1 o'clock Eastern time.